The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, CHD. Welcome to Pediatric Perspectives, where we are looking at children's health challenges with a different perspective, one that includes critical thinking, one that's not afraid to give you the honest truth. Today, we're covering a topic that I think is overlooked far too much, and that is pediatric dentistry, but in a whole different way. My guest today is Dr. Thomas Lockensgard. Welcome to our show, Dr. Tom, as you like to be called.
Hello, Dr. Paul. Thank you for inviting me. I really appreciate it. This topic, it's not out there.
No,
it needs to be.
People have no idea when they just go to a regular dentist that they're largely missing the boat. But by the time we're done, I'm probably going to have you on twice because we have so much to cover.
Sure.
But first of all, I have to tell you, you're just going to have to bear with me. I just read your complete bio today, and I am so blown away. I want people to know about you. So you are a biological, naturopathic, and anti-aging dentist from Minnesota, now residing in Nashville, Tennessee with your wife, Jan. You founded the Center for Holistic and Biological Dentistry.
Correct.
You're the co-founder of the Oral Med Aesthetics. And the Pearl Oral Health line of natural biological products. People can find that at pearloralhealth.com. You specialize in orthopedic orthodontics and biological dentistry methods. Our first segment here, we are going to jump into orthopedic orthodontics because I think there's a lot that can be done earlier than most people realize. You are on cutting edge of biological dental principles, and there is this relationship between conditions of the mouth and the whole body, and you really have gotten into that. You've spoken locally, nationally, radio, podcasts, health conferences. You've been on the High Wire with Del Bigtree, The Truth About Cancer, A Global Quest, The Health Awakening, The Michael Rood Show. You have 28 guided wellness protocols on your Dr. Tom for Better Health website, which is drlockensgard.com. That's a heck of a resource. You've written teaching modules for doctors, physicians, dentists, and lay people. And then I didn't know this, but you are known as Thomas Jordan in the record industry, gifted musician, singer-songwriter, and people can find that on Amazon Music, iTunes, Spotify. I'm going to look you up, and you're still active in the American Freedom and Health movements, which is where we've crossed paths. But most recently, you wrote a book that I just got and have almost finished reading word for word. Incredible book, Matters of the Mouth, which we'll touch a little bit on that. Thank you for joining us today.
Thank you for having me, Paul.
Did you always know you were going to do dentistry different, or what?
No, I got very frustrated with dentistry when I first started my career in Minnesota. I was just drill, fill, and bill. I was just a normal drill, fill, and bill guy, and it just didn't seem right to me. But I didn't know why. I couldn't figure it out. And then I went to a seminar, and I got into doing orthodontics, and I went to a seminar, and this guy said. The guy that was lecturing said, now, if you guys are going to do orthodontics and you have space or you have lack of space, why in the world would you pull 4 perfectly good bicuspid teeth and narrow down the arch?
As a kid in Africa, my parents were missionaries. When I was about, I'm guessing 10 or 11, they pulled 8 teeth. I have a very small mouth. Right now, I only have 1 biting surface on each side. In fact, one of them is not working right now. I have 1 biting surface. But that was the old way, right? You pulled teeth because the mouth was too small. And explain to us why that actually makes things worse.
In Britain, there was a guy named Edward Angle. He moved to America, and he's the guy that decided we don't need to, because in Britain and in Europe, they did orthodontics the correct way. They would expand out. So what I got into was expansion orthodontics, orthopedic orthodontics. And physicians know, like yourself, physicians know that when you push on bone, it moves. Most dentists don't think that you can move the mandible, or you can change the mandible. So they just make everything fit a mandible that has a kind of a kittywampus arch, if you would.
I remember taking my kids for orthodontics because they were born with small mouths like I have. And I think they were middle school age, kind of pre-adolescent, but I'm guessing that's a little late.
Well, you can see we start now when they're infants. If there's a tongue tie or if there's an underdeveloped arch, we can put them in an appliance. But basically, we start kids when their first molars are developed, and then we put in appliances that will actually expand out the arch. Now, this is not rapid palatal expansion. This is slow, very slow palatal expansion, which is why it works well. But it takes a while.
Let's pause a moment and go back to that newborn, because as a pediatrician for 35 years plus, it seemed to me, and maybe it was just I became more aware, but it seemed like tongue tie has become a much more significant thing. Can you explain that and then what to do about it? I mean, and whether you should, there's a lot of tongue tie procedures happening, and I'm wondering if the surgical procedures are actually as necessary as they seem to be.
If you have a kid, a baby, and he can't reach the roof of his mouth with his tongue, with his mouth open, then you need to have a tongue tie at least considered by a specialist. And
Right.
so we send because the big thing is that it prohibits breathing and it prohibits oxygen, which is huge. Because we all know that lack of oxygen is not a good thing, and so
Right.
it can cause narcolepsy and all kinds of bad things to happen. So we started earlier and earlier, and then once we get into once you remove the tongue tie, then you can take some impressions for the lower arch and the upper arch and make the palatal expanders.
How young can you start that?
Well, we've started some kids when they're still nursing
Wow.
with the tongue tie.
Wow. Speak
So
to the value of nursing compared to bottle feeding. Does it make any difference for palatal development?
it makes a huge difference. Now there's 2 pages in the book that specifically talk about that, and there's about 28 nutrients or maybe 24 nutrients that help speed up the growth, and it will help with the growth of the mandible, the jaws, and the bone formation. And besides, it's a more natural approach. So why would you use Enfamil and sugar and fluoride and all that kind of crap? Because that just sets you back.
This is the book you're talking about.
Yep.
And folks, you need to get a copy of this. It is so much more than just a simple dental guide. This is a guide to wellness. I love the fact, in a sense, our paths crossed in a similar way. I was
Right.
doing mainstream pediatrics, and I was finding that kids are just getting sicker and sicker, and we needed to get to root cause of things. And you address this very nicely in that book.
Thank you, Paul. When I got into orthopedic orthodontics, it started making a lot more sense to me. And then I had an orthodontist come to me, and he wanted to extract, in one of my patients that had just seen him, I had just seen the patient for the first time. He wanted to extract some second molars, upper and lower, and I thought he was nuts. And then
That's what happened to me.
the next week, that's when I went to the other meeting where the other dentist was, and what he said was, I mean, why would you guys take out 4 perfectly good teeth, and then let that and just narrow down and crowd down the arch even further. And I go,
Right.
man. And his thing was, everybody's kind of shaking their head, and he's going, "You guys have been taught wrong." And this was the start for me of a lot of training and orthodontic training, and it's fun because you can have fun with kids. You know how kids can be, telling
Yeah.
jokes and stuff. And so I still get emails from some of my patients who say, "Hey, did you hear about this latest joke?"
Yeah.
So,
I love that statement. You were taught wrong. I
yeah,
was taught wrong in medical school about so much. I was taught wrong in residency about vaccines and nutrition and so
no
many
kidding.
important areas. And I wonder if the viewers think about the things you've been taught, and might you have been taught wrong? Well, we want to correct the teaching here. You are a master educator in this important area. So we get a
Thank you,
baby,
brother.
we start them off breastfeeding. We really do everything in our power to make that successful, if necessary, even having the tongue tie revision done and the massage that needs to go along with making sure it doesn't kind of re-scar down.
Right.
When you're working let's finish the orthodontics part of our talk.
Okay.
When you're working with trying to get the mouth and jaw and all of that to be optimal, if I can use the word optimal,
That's
I
the
think in
word.
your book you talk about 3 different stages or phases.
Yeah, what we want to do is we want to send them through the arch form. We want to redevelop the arch form. And then we want to put, once the arch form is developed so that we've got enough arch space, and there's ways to figure that out, then we want to go ahead and put some brackets on there to straighten out the teeth. And then we want to, when we're done with the brackets, and that can take, 2-3 years, or it can take 1 to 2 years, or it can take 6 months, depending on how much of the teeth we've moved. Then we want to go ahead and put them in retention.
Those would be the traditional retainers that people sleep with?
Yep.
Okay.
It's different for every kid because every kid has different parameters and has different arch form. We want to get about 40 to 50 millimeters from molar to molar. And we want to make sure that the tongue is operating.
Yeah, I don't think I have that.
I'll get a ruler, Paul, and we'll go ahead and
I think I've got about just barely half of that.
Yeah. So, but moms come in and they're, what most dentists don't understand is that when a crunchy, I call them crunchy moms, because they know everything and they know a lot, and what they don't know, they're great at asking questions. But for those dentists out there who don't know about crunchy moms, they're there to interview you. You don't even know this. You don't know the fact that they want to interview you and find out how much you know, and how much, like your question about what about breastfeeding. I mean, everybody should be breastfeeding. So, right. And I don't remember what page those are on, but there's just lactobacillus, all kinds of enzymes, all kinds of natural stuff that helps the arch develop and the arch grow and the baby stay healthy. And that's what it's all about.
Yeah. No, you're mentioning probiotics, the lactobacillus and bifidobacteria, I think is the other one.
Yeah.
So important for your developing immune system.
Exactly.
And folks, if you're highly vaccinated and you're not breastfed, and then you wonder why your kids are sick all the time.
Yeah.
There's a direct correlation.
Yeah. Don't get vaccinated for whatever you do. Just do not go there.
Why do you say that?
Oh, didn't you hear, Paul? There's some evidence that it's going to be bad. You can have a bad. Yeah. I'll send you some. I'll send you some articles.
Okay. Probably want to quote that guy out in Oregon. Oh, that's me. Okay.
Yeah.
I'm just teasing. You guys know that's my wheelhouse.
Yeah, I know.
How about we pivot to just the general functional medicine, functional treatment work? What are the foundations for functional dentistry? Like what you do, how effective is it?
Most clinicians believe that health starts in your gut, right?
Mm-hmm.
It's all about the gut. Well, my question to you is, where does the gut start? It starts in the mouth. And you can't have a healthy body without having a healthy mouth. And there's the 3 biggest drivers of disease are all dental. Did you know that?
Not till I read your book.
Dental caries, gingivitis, which is reversible, and periodontal disease, which is not reversible. Well, it can be treated, but it's not reversible because you can't, regain the bone that you've lost.
Right.
But so those are the 3 biggest offenders in clinical medicine, and nobody really pays attention to it. You can't do an effective root canal because what you're doing is you're killing off all of the microbes, and then they go systemic. So first you lose voltage. When you kill a tooth, you lose voltage, then you lose blood flow, and when you lose blood flow, you lose voltage, and you lose more blood flow, and then the bugs wake up, and then they start producing toxins and endotoxins, and those endotoxins, well, like Piriformis gingivalis is one that goes right to the brain. And being that your mouth is close to the brain, I mean that's where the bacteria end up, and then they end up and they can cause all kinds of damage, all kinds of systemic damage. And I think it was Harvard Medical School just discerned and discovered this in 2001 and connected and related the mouth to the wrist, the whole systemic part of the body.
So what is the best way for a parent to care for their infants and then children's teeth? I mean, obviously at birth, most babies don't even have any teeth, so probably there's not too much to worry about in that regard. But when should they start caring for the teeth, and how should they do that?
The first thing you would do is you would breastfeed, and then have your and patients would always ask me, when should we bring our children? I said, bring them in with you. We'll horse around with them, and we'll get them used to us. And then, so as soon as they can cooperate, then we put them in the chair. And then I would use Oxy Mist, and I would use a Sonicare toothbrush, and I would oil pull. Oil pulling's in the book.
I read about oil pulling. I had never heard of that concept. Can you describe that a little bit, what it is and why you think it works?
Sure. It's coconut oil or sesame seed oil. And the first thing you should do when you get up in the morning, and you can use this on your little ones too, is get a tongue scraper and scrape the back side of your tongue and the sides of your tongue. There's all kinds of residual nasty bacteria that reside on the inside and the back side of your tongue. Do that, and then go in and do, after you're done with the tongue scraping, go in and do the oil pulling. There's just now one caution with oil pulling. If you're going to use coconut oil, which is a great oil to use, don't spit it in the sink.
Clog up your sink.
You got it. You got
Okay.
it. So you just swish for about 10 minutes, and then you spit it out. And then
You're just plain old organic coconut oil.
Yep.
And how much? I'm going to put a tablespoon or
Tablespoon. Depending on, I mean, a peewee kid probably.
A little kid could probably do a teaspoon, maybe.
Teaspoon. Right.
And you're going, just sort of swishing around.
Swish around for
not swallowing.
They say 20 minutes, but I think that's kind of that's
not going to happen.
Start with three to 4 minutes. And if you
Okay.
get to 5, or if you can get to 10, that's great.
How is that making a difference? What's actually going on?
It's killing the nasty bugs.
Coconut oil kills bugs.
It boosts the good microbiotics, microbes, and it destroys the bad ones. Then when you get older, as you grow up and as your teeth start erupting, then you use a Sonicare, which is sound waves.
I have a Sonicare toothbrush. It just vibrates really quick.
Yeah, but you put it on your teeth and you just kind of
Move it along slowly.
You don't do this thing. You just
Right.
kind of move it along. And then use our Pearl toothpaste.
I was introduced to that Pearl toothpaste when you launched it in Nashville, Tennessee.
Yeah.
At the Truth About Cancer conference. It was like, oh, wow. I didn't know you at the time. I didn't even know you were involved with that project.
Yeah.
But what's in it that's so special?
Carbamoyl peroxide. It's a mover for the dental fluid transport system. There's this, I've wondered for years why some people get decay and some don't. Some people who don't, and there's a dental fluid transport system that's in your body that shuttles calcium and shuttles minerals into the tooth, thereby they can remineralize. So that's one. And then we've got bentonite clay in there as a detoxifier. We've got 4 different oils that help with boost nitric oxide. We call it a nitric oxide booster, and that's huge.
So it's going to prevent infection primarily.
Prevent infection
and detox and usher in the right. I mean, tooth enamel is made from what? Calcium? What else makes?
Hydroxyapatite.
I tried that toothpaste. I wasn't a super fan of the taste, but it sounds to me like the importance of what it has for your health and the benefit of your teeth.
Right.
Sometimes you got to sacrifice the junk food.
Right.
Like
exactly. It's got fulvic acid in it, which helps with the mineral. It's got orthosilicic acid in it, which helps with remineralization. And it's got a ton of natural oils in it. And you might like to hear this. We've somewhat changed the formula so it's a little better.
Okay.
There's no fluoride. There's no foaming agents in that or any of that kind of stuff. So have them brush with that for a good long while, and then spit, rinse, and use Oxy Mist. That's all on our website.
Okay. So as soon as a tooth erupts, you can basically get started with that.
Yep.
Okay. That is wonderful. You mentioned fluoride, so I have to go there. It's been in the national news. Some states are now banning it from the municipal water.
Yeah.
When I was
in
trained,
2007.
when I was trained back in the age of the dinosaurs, it was thought to be the correct pediatric advice to not just advise using fluoridated toothpaste, but to supplement with fluoride and actually give oral tablets.
Yeah.
And the schools do this in many areas.
I did that when I first started because I
Yeah.
been
You were being a good doctor, right? A good
Yeah.
dentist. Yeah, me too. Although it never felt right. And I remember getting reprimanded by my supervisors when I was questioning this. It's like, I don't know about this. Anyway, briefly, just what's your take on fluoride?
Fluoride sucks.
It's a neurotoxin.
It's a killer.
Yeah.
I mean, kids have died on it.
And is it doing any benefit? Does it have any benefit?
They think that there's a slight bit of benefit to hardening the surface of the enamel.
Yeah.
But other than that, it's just nasty stuff. It blocks conversion from T4 to T3, so you have no iodine, and you have no thyroxine. It clogs up the pineal gland. It screws up with the pineal gland, and it causes dementia, loss of memory, and just a decrease in intelligence.
Right. It really does affect the brain and the brain function.
Right. Those have all been verified.
I'm guessing you're retired, so who would you send your best friends and loved ones to go see?
Dr. McKinnon Forbes in Nashville. What you need to do to find a like-minded physician, naturopath, dentist, you need to go to, and this is in the book, start with the IABDM or the IAOMT, all capitalized.
Okay.
And if you go to our website, down at the bottom, we have all these companies listed.
Fantastic. So folks, the website's going to be in the description here, and do this. I mean, just as you should find a pediatrician who is absolutely on board with letting you be in charge of your child's health and the decisions that are made, for example, with regards to vaccines and how you feed your child, etc. For dentistry, you need to do the same. Well, we're going to have you back, Dr. Tom, and I want to do a deep dive into your book and some of the other things you're passionate about when I get you back soon.
Okay. Thank you, brother.
Thank you.
God bless.
Thanks, folks, for watching. I'm Dr. Paul. You can find me at kidsfirstforever.com. I do coaching, and everything else I do is listed there. And it's always a pleasure to have you. We'll see you next week.
We're live. Okay, tell us your name.
My name's Dr. Susie Harris.
And what kind of a doctor are you?
I'm an applied kinesiology chiropractor and a functional health physician.
Okay, wonderful. And tell us, then do just go ahead and tell us what kind of things you've been seeing.
Well, I wasn't sure what to think in the beginning, just like everybody, when everything was hitting and the vaccines were coming out. And the first thing I saw was families divided, people losing jobs, kids getting pulled out of daycare. Because I have families that I help who have previous vaccine injuries, and so they don't vaccinate anymore. So the mandates really had an issue for them. But once things started rolling out, in the first 3 to 6 months, I would say I saw a lot of digestive issues, a lot of people coming in. One person in particular had their Crohn's under control. They were off autoimmune drugs, and then now it's back with a vengeance.
So is that after taking the shot?
Yeah.
Yeah.
And clots. I have 2 patients who've experienced clots in their legs, and they've had to go through treatment with blood thinners. And a lot of what I see is brain fog, fatigue, lack of exercise endurance, searching for words, so not blatant injury, but these like, why all of a sudden I used to be able to run 5 miles, now I can only run 2, and I start getting a racing heart. And in the work that I do, I listen to some of the frontline COVID care folks, those docs, and I would help through their protocols, getting my people to have access to them. And many of the folks that were dealing with the low-key stuff, that really helped clear them up, and it sort of got them to question what's going on. Others, I haven't been able to help so much. It was too severe, and they're working with other professionals to try to get severe neuropathy. One person I'm thinking of has such severe pain, it's like his skin, it's a nervous system thing. A young kid, athlete, getting chest pain and anxiety while he's practicing. And once we use the protocols that I've learned from like Dr. Henry Ely, Peter Corey, all these guys, I see the results. So as a chiropractor, I don't really have a test I can run to show I know this is from spike proteins and from the vaccines. But when I employ the protocols that the doctors I study under are suggesting for clearing these things, I'm seeing results. So, and these people were healthy before, and so.
And what kind of thing are you suggesting? And we're not giving medical advice out here, people. We're just chatting.
I'll just be vague about what you would do to achieve this, but what I've seen hands down is you sort of have to clear the liver, thin the bile and clear the liver, cleanse lymph, and get inflammation out of the blood vessels. So it's a matter of detox pathways open, getting circulation improved, and getting lymph movement improved, and people can start to move these toxins out of their body. How you do that is different for each person, but there is a fairly consistent protocol that I would point people to other resources to get, because I don't want to give advice today.
No, we do not want to give advice.
No, thank you.
No, we do not. So what's your conclusion then? I mean, it's extraordinary to me that people still think it's okay. I spoke to a family member, let's put it that way, who's off to get their COVID shot and their flu shot in the same day.
I know.
So we're not really, I mean, we've got our communities bigger and reinforcements have arrived, but we're not really getting to the masses, I don't think.
No. I mean, it's so unfortunate. Part of what I wish I could have an effect on would be, I guess it gets simple. It comes down to informed consent, because you can't inform people about the dangers of something if you don't have all the data. My conclusion, though, like you asked me, I would say not everybody had a terrible reaction as far as I could tell, but I would say, I'm going to say 30% of my practice, probably 70% of my practice chose to vaccinate. I'd say of those, 20% had issues that were disrupting their lives. And I'd say another chunk of those people were just not performing well. And I guess what I understand from the docs I study under and what I've seen with my own eyes, the spike protein is a part of this COVID-19 virus or whatever it is, and times a bazillion when you're getting the shots, because we have way more of those spike proteins coming into our bodies when we get the shots. It's a huge inflammatory response. I think when it's coming in through the arm, it can get into the bloodstream and go wherever it likes. It can cross the blood-brain barrier, as opposed to when we breathe in the virus and we have our upper respiratory immune system kick in. And if you're in trouble and your body's not handling it, there are protocols, which brings me to the next thing. The rage I've had watching the lack of accessibility to the treatment protocols that I've seen with my own eyes working on people. But there's so many people that don't know about it, and there's a lot of shaming and humiliating if you try to talk about what you're seeing as a protocol that has worked very well. Super irritated with our Department of Health and the different places that should actually be including this information.
And remdesivir, I mean, the remdesivir deaths are out of control.
It's right in the study from H1N1, they pulled it because it was causing kidney damage. So, yeah, it's upsetting. And it's, The other thing I would mention, the mental health issues are off the charts, and I have friends who are therapists who are just flat out. They don't know how to help because there's not enough. They have to not return phone calls. Young people who are so afraid, the isolation. It's getting a little less now because we're sort of in this phase of like, it's not as up in our face, but I'm wondering what's going to happen as every year we come back from the summer and everyone gets sick with colds and flus, because it's what's happening when we bring our microbiomes back together. But we have this fear experience we've had that I think is going to layer over the top of a natural experience of people getting sick in the fall. And I'm switching subjects, but I want to go back to the kids, because I've seen children not wanting to go to school. They're still afraid. And one mom told me a story. She couldn't get her 2 little girls. It would take her an hour or 2 to get their masks off while they were home, once they were home from school, because they were so afraid that they were going to either be harmed or harm someone based on what was being said to them at school. So, I mean, what are we doing?
That's terrible.
Natural immunity is a thing. And I feel excited because now we've got data. It's been a number of years. We've got world-renowned people at the top of their expertise, doctors and lawyers that are out there bringing the data, Children's Health Defense. Everybody's kind of bringing it into the light. And I'm seeing more people kind of cock their head a little bit, like, I'm going to think about this for a second. Less quick to jump in and just do it out of fear and the way they coerced with all the language of do your part and all that stuff. So even though it's been hard and fatiguing to hold all the stories and try to be helping while I'm being ridiculed, and you know, I've had to keep it to myself quite a bit, and also walk a line between the people in my practice, because I respect those who chose. I'm here to help if I can, you know. So it's been a lot of biting my tongue, but at this time I've never seen more people looking at these issues, and that is just that's a beautiful part. I'm so glad to be here at this time while this is coming up, and try to help bring it to a place where we can work together. I don't really like us and them conversations. It's hard not to go there though when I see people that I care about very much being hurt.
What do you know about shedding?
I witness it.
Have you experienced it?
Yes. I ask people to not come in my office for 3 weeks after they choose to get a shot, because I started not feeling well, and some of my staff as well, and I was hearing from Dr. McCullough and Pierre Corey and people like that talking about shedding. I was like, oh. So I went and read the Pfizer's safety and efficacy study that talked about, they were really referring to pregnancy at that time, that if a woman were to have an adverse reaction to, they called it the intervention therapy, they wouldn't even call it the vaccine, they could be exposed to it by inhalation or skin contact. So I was like, oh, that might be what's happening. So we started using the protocols and asking people not to come in so soon. And I've had, I'm going to say 5 or 6 patients who are massage therapists who've gotten very ill. A lot of uterine issues. I don't get to say this as a truth, but I have questions about the uptick in cancer in my office, and some of them very fast moving, and who doesn't know somebody? It's like all of a sudden everybody's talking about that. So back to the shedding though, it seems really evident to me. I have young kids coming in who are not vaxxed, but they're in a classroom of vaxxed, and they have symptoms that are like the folks that have gotten them, and so we run the protocols and they improve. So I don't have blood labs and I don't have, statistics like that, but I have clinical data of seeing the symptoms look the same running the protocols that seem to be helpful and thinking, wow, it happens to this child every time she comes home from daycare. She only goes twice a week. She's home for the weekend, she's good. She goes back, she comes home after, and she starts having fevers and can't sleep and is real irritable.
And this vertigo, lots of people feeling so dizzy.
Yeah, inner ear congestion, I think. You know what I think? I don't know if this is true, but I feel like because the spikes are so inflammatory and they start to mess with the circulation, then the liver starts to get a little involved, then the lymph gets involved. And so you have this kind of stagnation of lymph and circulation movement of the upper respiratory. So inner ear, which is where a lot of vertigo and ear ringing can happen, brain fog. So if you can get those downstream detox pathways open and use some of the protocols that are there, this seems to be able to drop and start to bring in some relief.
Where can people follow you, contact you, see what you're doing? Is there any website or?
Sure. I mean, they could go to my practice, I guess. It's Cedarwood Natural Health Center. It's just cedarwoodnaturalhealthcenter.com. I'm hesitating because we're so busy. I'm like, oh God.
But please
that's
don't
okay.
really come because we can't handle it.
Yeah, no. No, I love educating people, and I'm not attached to if they pick up what I lay out. My thing is they're only hearing one side of the story. And why all of a sudden all these tests that are being run by the medical docs to try and understand their mystery disease? All the labs are good. Why am I not okay? And so I like being able to bring in people into the methods that we use and help them see, is this what's happening? And if it is, what can you do about it?
Is there anything else you want to tell the people?
Remember, your body is amazing. It knows how to heal. Your immune system is pristine. Primarily, the only reason it wouldn't be kicking it in most incidences is something's in its way. So it's about clean food, clean water, access to functional health care, and get more data, open up a little bit, and look at more angles before you make your choices. I'm seeing too many negative outcomes without enough payoff, the risk payoff piece. So I would say just be careful.
Very careful. Okay, well, thank you so much for your words of wisdom and for all you do.
Oh, thank you.
I really appreciate it.
Thank you too, Polly.